By 2050, 1 in 5 San Diegans will be 65 or older. Gary and Mary West are driven to meet the growing needs of this growing population by making healthcare more affordable and accessible, by bringing together the best of science, research, and clinical practice to improve patient outcomes, and by building a blueprint for care that enables seniors to successfully age in place, preserving their dignity, independence, and quality of life.
I would describe Mary and Gary West as really maybe the most genuine and warm people I've ever met.
Pioneering philanthropist, humble, innovative.
Their desire to really make a difference in the lives of seniors is unwavering, and they will not be deterred in any way.
I've always loved seniors, and I've loved spending time with them and hearing their stories. And so I told Gary if we ever have an opportunity to help poor seniors, I wanted to do that.
We have to figure out ways to allow our healthcare system to serve more people more cost effectively than it's doing now.
With UC San Diego, Gary and Mary West have made a promise to create an environment where seniors can thrive and have access to the services that they need to be independent and at home for as long as possible.
Really, the West inspired us to work on this project to build an emergency department, or part of the emergency department that's truly dedicated to meeting the needs of our vulnerable seniors and older adults.
So by having the Gary and Mary West Geriatric Emergency Department, it really serves as the hub for care delivery for our seniors.
So why this population is a little bit different is that oftentimes the reason seniors come to the emergency department is that they have an underlying challenge that maybe a healthy person doesn't have, that is causing them to come to the emergency department. What we want to do is be able to prevent those kind of return visits and really help the senior, address the underlying condition that brought them to the emergency department so that they can prevent issues down the line months or years later.
We're creating all these connections across the healthcare system, to ensure that we're making the right connections for the patients depending on what their needs are. In this way, we've been able to provide just a level of care that is not found anywhere else in the region.
We've created the first level 1 geriatric emergency department, and that is just the beginning.
What's really cool about this is that Mary and Gary didn't just stop there, but they looked across the whole San Diego region and they said, look, that's great, but we want all of the hospitals, all of the emergency departments to have geriatric protocols and geriatric care.
They created this effort and this initiative just over 10 years ago. But their impact has been tremendous in those 10 years. They get attention in Washington, D.C., they get attention in San Diego, they get attention across the state of California. I think that's truly impressive and inspiring for the rest of us.
None of this would have been possible without the incredible generosity and vision of Gary and Mary West, and without incredible partners like UC San Diego Health.
I'd just like to say thank you to Gary and Mary West for your incredible generosity and vision. Thank you so much for your really deep commitment to UC San Diego and to our community.